Okay, so today I'm doing new patient consultations and young John has come in, age 16, right? And the point I'm trying to explain to dentists and medical doctors and anyone who deals with airway obstruction is that if a child has nasal obstruction concerns, that the palate is not going to form properly. So if we look here, John, just over here, if you look at John's palate, you can see how narrow it is, right? You can see we have almost like a double layer of teeth, but it's not because his teeth are macrodonic or he has too many teeth, it's because his palate is too narrow. Now, at a young age, sort of before 7, I find that you can use the tongue as the expander. So say at 7, John was seen by an ear, nose and throat doctor, and we were able to work out the cause of the breathing problem and then retrain John to sleep with his mouth closed, breathe through his nose, put his tongue up. That would give us the natural expansion. After 7, when the first molars erupt, you're never going to get natural expansion. Then you have to use an expander. But even then, between 7 and 9, just using an expander could minimize the need for full fixed braces later. What I don't want is to wait till 16, because at 16 we've got a big job on our hand. And that big job would involve surgical expansion of the maxilla for stability, followed by full fixed braces, etc., etc. And even at that stage, when you surgically expand the upper palate, it may not necessarily improve the nasal breathing because the palate's already formed, right? There is one technique which we'll be discussing at our future conference called the dome technique. Dome technique was developed at Stanford University, and Dr. Stanley Liu is one of the best surgeons who does that. Dome technique uses 4 tads in the palate so that as you broaden, you actually get a big improvement in the nasal airway, right? So a couple of learning points. Number 1, if you get a kid who's got nasal obstruction problems and you see a narrow palate, get in early, don't wait for permanent dentition. Number 2, during mixed dentition, you can widen the palate non-surgically. Number 3, even at this stage with that palate so narrow, don't take out teeth. Because if you take out teeth, all you're going to do is make the palate narrower. Instead, broaden the palate using newer techniques, right? This is Saskia. She is organizing the conference, and it's through the Australasian Academy of Dental Sleep Medicine. And what we'll be discussing with a number of individuals, so it won't just be myself talking about orthodontics, there'll be an ear, nose and throat doctor, there'll be a myofunctional therapist talking about how to change tongue posture. And there'll be a surgeon talking about surgical expansion. So anything you want to know about when to treat narrow palates, how to treat them, how to keep them stable, I think it's really important you come along and listen to these people. 20 speakers over 2 days so that we don't end up with major orthodontic concerns. I think that's an important take-home message for any general dentist.